and really am passionate about this particular topic, so I'm excited to give this presentation today. So today we're just going to be talking about mental and behavioral health care needs in the Hispanic and Latinx community. We're going to talk about current issues, some current data as well, and then some recommendations or some steps that you might consider in terms of how to promote resiliency in this particular population. So just to give you a little bit of background to data currently in Ohio, it's a little dated, it's 2017, but this is sort of the last report that ODH has sort of put out in terms of their publications. But one of them is sort of on the BRFIS, which looks at different variables in terms of health practices, health behaviors, and health conditions among residents throughout the United States. What it does is that it administers the interview over the phone, and they compile data across all of the states, including Ohio, and they get some information on health behaviors and health practices. And so what they do look at are some mental health variables. One specifically is, how do you rate your mental health? Do you believe that your mental health, would you rate it as poor over the last year? And essentially what we have is sort of the demographic breakdown of the responses on this particular item. And if you look from left to right, you have your white or Caucasian population represented at 13.7% of respondents said that they would rate their mental health status as poor, 13.4 respondents as Black or African American, 21.9% of respondents of Hispanic or Latinx identified background. There was not sufficient data for Asian or Native Hawaiian and Pacific Islander population, and not sufficient data for American Indian and Alaskan Native population. Other individuals were noted at 14.5%, and then multiracial, which I think fell off the graph, but multiracial is represented by the highest bar there at 25.1%. So when we look at this data, we see some disparities in terms of poor mental health status ratings. What you also see is an issue of equity when we don't have sufficient data to basically capture information or variables on some of our populations that are represented in Ohio, but just aren't represented in terms of some of these publications and the data that comes out from some of the research. When we look at children, so the OHYES is a high school survey that gets administered. The caveat or the disclaimer to OHYES is that schools sign up to administer it. So this is not representative of all high schoolers in Ohio, because only certain counties or certain school districts do administer it. So there is that caveat there. But of the respondents or of the schools that administered the OHYES to their population, there are items or variables that look at mental health status. So for anxiety, if you will, basically what you're looking at are the demographic breakdown of respondents who rated that they felt anxious over the past 2 weeks. And you'll see we had data from 2015 all the way to 2018 most recently. And so you'll kind of see the trends in some of the respondents responding over the last several years among these demographic groups. Again, if you sort of eyeball the data here, you do see some disparities among our demographic groups. Our Hispanic and Latino population particularly noted to be a little bit higher in terms of their ratings of anxiety over the last 2 weeks across years. And then also noting that our white non-Hispanic individuals, as well as our multiracial or other category, also had sort of higher ratings in that 2016-2017 year. For our high schoolers, we also see items, also reports of feelings of depression or symptoms of depression over the last 2 weeks. And again, eyeballing the data, you do see some disparities, particularly among our Hispanic and Latino adolescents. Nationally, we are seeing higher rates of suicidal ideation and serious suicidal attempts among Latina adolescents, so female Hispanic high schoolers. So that's particularly notable. And again, given the focus of the presentation today, it is noted that the rates among our Hispanic and Latino teenagers tend to be a little bit higher across several years. Also, the OHYES asks if you've been feeling sad or hopeless for more than the past 2 weeks for more than 2 weeks over the past year. And again, you still see higher rates among our Hispanic and Latino respondents, again, among high school students. And then when we ask about seriously considering attempting suicide over the past year, we do see some interesting findings here as well. Again, among our Hispanic and Latino adolescents, higher rates are being reported, as well as among over the 2016-2017 year among our multiracial or other category. But we also note in 2016-2017 a spike in this particular item among our Black African-American teenagers as well. So when we think about Hispanic and Latino adolescents, we've sort of identified some of the common concerns that we see: mood issues, anxiety, but we also see higher rates of post-traumatic stress disorder as well as substance use. So these are some of the common concerns that we see in our Hispanic and Latino population when it comes to their behavioral health needs. We actually, in terms of current data, we know that we can't really talk about behavioral health without the sort of the context of the current pandemic. So we actually administered a COVID-19 exposure and family impact survey to different households throughout Ohio that were identified as Hispanic or Latino. So basically, they received an email or text link to the survey, were able to complete it voluntarily. They would receive a $10 gift card for their participation in completing the survey. And they could complete the survey in English or in Spanish. And we sort of had this survey disseminated through various social service agencies, various key stakeholder groups, to make sure that we targeted our Hispanic and Latino communities throughout Ohio. And what the survey results sort of were broken down into in terms of the domains were extent of exposure. So who in your family, or have you experienced a family member who's been exposed to infection? Have they been confirmed infected? Has anyone spent time in the hospital? Things like that. That's what falls under exposure. What was the financial and occupational impact for some families? We asked about daily stressors. Did the pandemic make it hard for you to obtain, sort of daily needs, which gets at to that daily stress component. And then we asked obviously about physical and emotional well-being and how disruptive the pandemic was to children. I'm just going to highlight some of the results that really tap into more of the physical emotional well-being for the respondents. So of respondents, when we asked them, has the pandemic had a negative impact on your well-being across these different domains? 66.3% of respondents reported that the pandemic made their exercising or their extent to which they could exercise worse. 64.7% reported that it made eating or their appetite worse. 74% reported that it made their sleeping or the quality of their sleep worse. 83.7% reported that their anxiety was worse or that it created anxiety for them. And then 79.6% reported that it made their mood worse or created symptoms of depression for them. And so you see, obviously, given the extent of the pandemic and obviously how it impacts, every individual, we're just looking at sort of a snapshot of what is potentially the impact here on our Hispanic and Latino communities. And obviously we are seeing an impact in their physical and mental health. We also asked respondents to indicate the level of distress that they have felt in response to the pandemic. So ratings of distress, where you were just asked to rate on a 1 to 10 scale, 1 being zero distress or minimal distress, 10 being the highest level of distress that you could report. On average, the respondents who completed the survey reported that their rating of distress was around a 7. When asked, how would they rate the distress that their children have felt as a result of the pandemic. So, caregivers or household members responding for their children, they rated their children's distress at about a 6.7. So again, this is just to kind of give you, some current data in terms of behavioral health in this community. It is not, completely representative of all Hispanic and Latinos in Ohio, but it gives you a general sense of sort of the potential impact and sort of what we're dealing with in terms of behavioral health. We also asked individuals who completed the survey, what are some qualitative, feedback that you could give us in terms of the effects of COVID-19 on your children and your family and or your household. So you'll see, we just sort of took out a few samples of responses here. So you'll see some references to stress, thinking the worst, having to count pennies. So again, that financial impact. Positive, impacts, meaning, we would talk more. Negative impacts would be stress, anxiety, boredom, excessive use of electronics. And one individual, reported that they had actually lost a lot of their hair and they've had a lot of difficulty sleeping. Again, getting at that stress impact. So these are just, samples of different responses, again, to get at that behavioral health or mental health impact, people reporting stress and a lot of depression or depressive symptoms. This person had reported that my children are frightened and get anxiety when, we hear coughing or sneezing. I had to be on antidepressants. I felt frightened of losing my loved ones. I started drinking heavily to calm the fear. I gained 40 pounds. Everyone has gained weight. We wouldn't let the children out to play for fear of the virus. On the positive side, children are closer than ever, and we honestly love having them home. So when looking at, again, the potential impacts is we want to understand the negative impacts, but we also want to look at what are some opportunities where we can sort of look at potential strengths or potential like post-traumatic growth. So areas of growth, areas that we can kind of utilize in terms of helping to build and promote their resilience. In general, when we think about the Hispanic and Latino population broadly, risk factors, obviously the pandemic impacts everyone. So obviously that is a risk factor, is the extent of the impact of the pandemic on yourself. But historically and currently, there are other common risk factors among this population. Violence and trauma, and that can be related to immigration. So your country of origin. So what was that pre-migration experience? Was there any violence and trauma in part as part of the immigration experience? And then having arrived to the United States or your country of destination, your host country, what has been the experience there? Has there been any trauma or violence associated with that? And so that sort of gets at the migration history. Racism and discrimination, we do know that in terms of the sociopolitical landscape, there are experiences of racism and discrimination for this population. There is stress related to immigration, whether that's current immigration proceedings, whether that's fear of deportation or fear of regarding your deportation status or immigration status. Those stressors can definitely impact not only an individual, but also a family and household as well. There's also culturative stress. So there are, particularly among different generations within a family, so parents and teenagers or parents and children, there can be differences in level of acculturation that cause some culture clashing and can cause some family conflict. So that's something of note as well. And historically, we do know that there are some equity issues when it comes to this population in terms of receiving mental health and behavioral health. So lack of access to services and barriers to help seeking, whether that's related to stigma related to mental health in this community or just physical sort of structural barriers that are related to issues of equity. So we also know that there's some, current issues that are particularly impactful for this community right now. We know the opioid crisis in particular is negatively impacting, this community. As I mentioned, issues related to potential discrimination or harassment, if you will, issues that relate to, status in terms of recent rulings regarding DACA and how stressful that has been for this population. We have here, the issues of DACA and Dreamers that the Supreme Court took up. Issues related to peer victimization and bullying. We know that that's an issue that has been, in place or has been present for a lot of children. For Hispanic and Latino children in the most recent several years, there have been a lot of instances or increased instances of bullying and peer victimization, particularly comments related to immigration status, things, build the wall, go back to Mexico, things like that have been uttered and have been documented. We do have, the crisis of family separation at the border and the trauma associated with that. Again, sort of separation. And then more recently, in the last just over a year that we've celebrated sort of the year anniversary of the devastating shooting in El Paso that was racially motivated. And so this community is dealing with sort of the after effects of all of these ongoing traumas. Particularly, noted, I think it's important to consider this, concept of ethnoracial trauma. So this experience of individual and or collective psychological distress from experiencing discrimination, threats to harm, violence, and intimidation. And ethnoracial trauma can also be present in children and youth who witness discrimination or violence to others, including their parents or siblings. So I think what's important to sort of, hit here is it doesn't necessarily have to be just experiencing physical violence or physical, aggression that can create, those trauma symptoms, but rather any psychological distress that results as a result of experiencing discrimination, microaggressions, threats of harm, intimidation, that can be as devastating for many of these individuals, and for children who witness this happen to family members, people in their community. It can be as well resulting in trauma symptoms and can be just as devastating. So what are some of the protective factors that we look at with this population? Well, we do know that generally speaking, and again, none of these are going to be sort of universal. Every individual who identifies as Hispanic and Latino adopts these values, but these are some of the things that historically have been thought to be potential protective factors in this population. So religion and spirituality. So having strong belief system, having a deep connection to religion, to spirituality can be a protective factor for many Hispanic and Latino families. This emphasis on familialism or collectivism can be a strength and a protective factor for this population. So the idea of sort of community and caring for the community, caring for the family all together can be a protective factor. This idea of personalism, so really focusing on relationships and the nature and the quality of establishing good relationships. And that's particularly important when it comes to providers or healthcare providers. We do see Hispanics and Latinos really emphasize sort of this value of personalismo, which is personalism, about sort of this almost idea of formal friendliness, trying to have sort of a warm, friendly relationship with some of their providers. That they do emphasize social engagement. So not only necessarily emphasizing the family, but that can extend to the extended family, the community at large. And so their social networks can be very important to them. And as well as cultural identity, having a strong sense of cultural identity or having a strong understanding of sort of their own salient aspects of their identity can be a protective factor as well. So how do we build resilience in this population? And again, this presentation is just meant to sort of give you a very brief, overview of some of these things. But certainly I wanted to try and cover, a lot of different things at a very, high level, but then potentially, offer, as myself as a resource if you wanted to follow up on any of these concepts. But basically, in terms of building resilience, we want to build the capacity of people to cope with stress and life problems. That's sort of the goal of building resilience. And how we do that is really focusing on strengths and assets that help build that resilient sort of mindset, and then promote resources that foster resilience. So again, if we think back to sort of the survey that we administered, when we asked about, how has COVID impacted you, we also wanted to know, what positives have come out of it, so that we can leverage those to try and help foster that resilience for these individuals. So when we think about the Hispanic and Latino population, we think about a lot of different things that potentially can go towards building resilience. One is first connectedness and social support, positive experiences in one's community, positive cultural identity. I sort of mentioned, given that cultural identity is extremely important, promoting safety and security, early identification of signs of distress, and then linkage to resources. And I'll go through all of these a little bit more in detail. So when we think about connectedness and social support, it is establishing a community and sort of establishing a social network for individuals that is supportive, that they have trust in, and that they're comfortable with. So ensuring, especially for children and adolescents, ensuring that they have access to caring adults, teachers, mentors, friends, or peers. That could also mean ensuring that they have access, again, because religion and spirituality can be particularly important for this population or members of this population, that they have a connection to their faith communities and community-based organizations. I really want to emphasize the community-based organizations because a lot of our Hispanic and Latino Ohioans rely on or go to our social service agencies within their sort of area or their community-based organizations, and rely on them a lot for not only for information, but also sort of for resources as well. And so a lot of the individuals in our survey sort of mentioned that, they felt very fortunate having, an identified agency and identified organization that they had trust with and established relationship with, and felt like they would go to them at any point during the pandemic with any question. So even if it's a question that maybe the doctor would answer, or a question that school might answer, they still might go to their trusted community-based organization before they go to those other entities, because they just have an established working relationship with them. So really sort of emphasizing the role that some of these community-based organizations play in these communities. Really trying to promote positive experiences in one's community. So that includes intentionally creating safe and welcoming spaces for, not just Hispanic and Latino individuals, but obviously individuals from any background. But obviously for the purposes of this presentation, we're focused on Hispanic and Latinos. So safe and welcoming spaces that may be, creating, visual signs or having visual pictures that shows, that we welcome all, or that, this is a place that is going to be comfortable for you. So in any way, having to demonstrate sort of the welcoming or inclusive nature of an organization or a space can be important. And then obviously having strategies for inclusion. Every agency or every entity should, in theory, have strategies for promoting inclusion, promoting belonging within their agency. And how do we establish sort of positive, or how do we promote positive cultural identity development? For some of our young people, and for some of our Hispanic and Latino families, that might be linking them to cultural groups and organizations with whom they have a commonality or common bond. So really trying to help, promote those aspects of their cultural identity that they feel is most salient. And connecting with community groups or other, groups that they, again, may have commonality with and may feel, taps into, again, those salient parts of their identity. That's going to be really important, again, for any individual, really, but for, again, the focus of our presentation are Hispanic and Latinos. Safety and security. So as I mentioned, one of the stressors, or one of the big stressors for this population may be related to, discrimination, sociopolitical dialogue, harassment, as well as, concerns about immigration status. And so really promoting safety and security for this community is incredibly important. That would include, identifying a circle of trusted individuals and community members, getting assistance from Hispanic and Latino serving agencies in Ohio. Again, they serve a really critical role in a lot of these communities. And so really relying on them to help sort of identify, what are the needs for the population and what are the resources and recommendations that they think would be most helpful. And honestly, just for promoting, knowledge is power. And so really helping individuals to understand what their rights are, particularly if they are concerned with regards to their immigration status or their family members or community members' immigration status. What are your legal rights when it comes to immigration related proceedings? What are your rights when it comes to being approached by a law enforcement official? And so just ensuring that people have the information that they need to feel comfortable in navigating some of those rather stressful situations. When we think about early identification and intervention, it's really critically important to kind of consider those cultural aspects of distress. And so what are the signs and symptoms of distress in, a diverse population may look different than what we historically would consider or what we historically have known. And so with the Hispanic and Latino population, symptoms of distress may present more initially as physical symptoms. That is something that we sometimes see, is that somatic complaints of headaches, stomach aches, that may be the first report that they have. They also may have different sort of verbiage for how they describe what is occurring to them. And so that's important to sort of be aware of in terms of how you conceptualize or how you think about a behavioral health presentation for this population. That gets to sort of this need for culturally appropriate screening and assessment. So really thinking about, when you do your screening and when you do your intake, are you utilizing questions, or are you using questions that get at some of these maybe cultural nuances or cultural factors that could be impacting their presentation, as well as treatment and intervention. And so really sort of taking a more critical look at your own, screening tools, how you do your behavioral health assessments, how you do behavioral health work can be important, just to have an eye towards cultural appropriateness or cultural sensitivity. Promoting coping resources and skill development. So obviously, we in general want to make sure that as early as we can, we are fostering good, healthy and adaptive coping skills in children and adolescents, early on, but then also equipping them with coping resources so that when they do encounter stressful situations, they're a bit more prepared or a bit more protected in terms of the potential negative impacts that those stressful situations would have. Conducting brief intervention and follow-up. So for many of, individuals who present with behavioral health concerns, they may not need long-term treatment. They may not need long-term therapy. And so really recognizing, could you benefit from brief intervention and follow-up? And do we have, any resources in order to maybe make sure that you are able to follow up with intervention? And then referral for more traditional behavioral health services as needed, obviously. As we mentioned, there's some equity issues when it comes to the Hispanic Latino population in terms of ensuring that they can access behavioral health services, that they can access appropriate care when they need it. We're going to talk a little bit in our recommendations portion about what are some ways to maybe help promote access or increase access, but that is something to consider, because once we identify concerns, we need to make sure that we can act on them. And sometimes, per reporting from a lot of our Hispanic Latino families in Ohio is, and from their community-based organizations that they work with, is once they're identified and they need behavioral health services, sometimes the gap is, where do we send them? Who is able to competently work with this population? And sometimes that's a barrier that a lot of those organizations hit. So how do we improve cultural proficiency for behavioral health agencies? Part of this is, as I mentioned, there's gaps in resources. So we may not have enough Spanish-speaking providers to meet the need of our population, but we certainly can improve the cultural proficiency of the current providers who potentially do not speak Spanish, and also increase the cultural proficiency of agencies, behavioral health agencies throughout Ohio. So how do we do that? First and foremost is always be aware of your own biases and beliefs that may impact your interactions with patients and clients. Establishing or sort of adopting this cultural humility approach is always going to be really critically important to achieving cultural proficiency. Learning about the community where patients and clients live. So if you are encountering a significant proportion of your patient population comes from a community that maybe you're less familiar with, it's being intentional about finding out more about that community and learning more about that culture. And just in general, finding out more about the community in which your patients live to sort of get an idea of what that lived experience is like. For a Hispanic and Latino population, that may look different, whether they're Hispanic Latinos in Cleveland versus Cincinnati versus, Columbus. Their experiences are different because a lot of them also come from different Latin American countries. And so really trying to understand, the community they currently live in and where they've come from in terms of their cultural background will be really critically important. And then learning about community assets and resources. This is particularly important as we, again, try to address those gaps that we have in the behavioral health system. So what are the community resources that they have? And are we knowledgeable and aware of those? Sometimes I am surprised at myself when I have families that I work with, predominantly Hispanic Latino families here in Cleveland, who I work with. I have tried to do like an environmental scan of what's available here in Cleveland in terms of, community resources that potentially, if they're unable to access certain services, there are resources available for them. And I think, as we try and, develop more of a focus on equity, for all of our underserved populations, I think really understanding community strengths, community assets, and what those resources are is incredibly important. So how else can you develop cultural proficiency? As I mentioned, those community-based organizations are incredibly important. For a lot of our communities, they are the touchstone. They are the first sort of line that our families will go to. And so developing relationships with those trusted community-based organizations is important. And identifying, what services they provide, what are their, general perceptions of what the needs are of the community, and what are they currently, doing or working on to help the community is incredibly important to be aware of. And then work collaboratively with key stakeholders to facilitate a coordinated response or effort. And so again, there's sort of this, emphasis on making sure that we think communities are the best at solving their own problems. And so really trying to work with key stakeholders who are working in that community and with that community on facilitating more of a coordinated response or effort. We don't want to duplicate, resources. We don't want to duplicate or make efforts redundant. So really trying to come up with a more coordinated response, and where does your agency or where do you as an individual fit in that coordinated response? When I mentioned sort of what are some ways to increase access to behavioral health services, one is to utilize culturally and linguistically sensitive services. So there's this notion that we also want to bring behavioral health services into the community, as opposed to having community members having to leave their community. So in our Hispanic and Latino population, we don't necessarily always want them to have to leave their community in order to seek out behavioral health services, but are there ways that we can kind of bring behavioral health services into their communities themselves, which makes it more likely for them to engage and more likely to maintain and retain engagement in the system. So one of the ways that we can do that is through utilizing different services like cultural brokers. So cultural brokers basically just sort of function as almost like a go-between between two cultures. And cultural brokers can really serve as sort of that initial entry point into behavioral health, and then can help both family members or patients or potential clients as navigate the healthcare system. And so cultural brokers can be really critically important in that role. We also have these community health workers who focus on mental health. They are known as promotores de salud mental. So basically mental health community health workers. And these individuals really are members of the communities themselves who have specialized training in mental health, and who work to provide some of that mental health information and disseminate it into the community, even provide brief intervention in some respects, and ensure sort of that linkage to resources outside. So they sort of, again, sort of function as a go-between a little bit, but focus specifically on mental health. And then always for agencies and individuals to assess their own culturally and linguistically sensitive practices. So is there an ongoing commitment in your organization? Is there an ongoing commitment in your agency to constantly sort of assess your own practices and monitor for improvement? So one of the things that I think happens sometimes is we'll maybe implement a strategy. We think it might be helpful. We implement the strategy, and then we maybe check back in like a year. How did that strategy go? What was the outcome? What ideally we'd like agencies and individuals to do is do more of a constant or more continuous assessment process, if you will. That way, if a strategy isn't working, within the first, several months of implementing, we can change it, we can adapt it, so that we're not losing time in that way. We're not sort of wasting resources. And so really trying to focus on this continuous assessment and progress monitoring model of strategies to increase our inclusiveness, increase our sensitivity to diversity, and then increase our efforts for equity. And so that process is meant to be more continuous in that way. So those are just the references. So I really, I know I'm sort of trying to always keep the presentation to about 15 minutes so that you guys have plenty of time for case discussion. But I wanted to, just give you sort of a very sort of high, very cursory, superficial sort of introduction to some of these concepts. And obviously I can always follow up with anyone if you're interested in more information regarding this. But again, when it comes to our, growing Hispanic and Latino community in Ohio, there's a lot that has been done, but there's a lot that still needs to be done. And I think, starting here, thinking about your own practices, your own, procedures, and how culturally sensitive they are, and definitely sort of that commitment to constant improvement in that area is going to be one of the key steps for everyone. But then also certainly, I think trying to develop some other innovative ways of basically providing behavioral health services. Sometimes, again, as I mentioned, maybe going into the community and coming up with more innovative models of disseminating some of this information to the community at large are going to be the two areas that we really do focus on, I think, moving forward for this population. And if you guys have any questions, obviously you can reach out to me.